little bit about wisdom teeth. Why should I have my wisdom teeth removed?
Well, not everyone needs to have their wisdom teeth removed, but by far the vast majority of us don't have enough room for them to come in. So they wind up getting stuck somewhere below or above where we would like them to be functional. This is an open door to a raft of problems that are too long to describe, even when we're sitting together just chatting. I guess that the important things to me are that young people do really well, and we like it when we're talking to folks who are in their late teens or early 20s who would then have the most likely option for an easier procedure, a more rapid recovery, better healing, and a lower rate of complications. The problems that wisdom teeth cause are usually infection, but they also are very prominent in the development of certain kinds of pathology. And as folks grow older, after they've retained these things, because of the time involved, the opportunity for those problems to crop up increases. So it's more than just a rite of passage. It's a health benefit that is certainly preventive. In many cases, it's not preventive, but it's a problem that is ongoing, and we help patients solve that. But it does seem strange to come in with never having had any symptoms or any issues with their wisdom teeth and have somebody say, you got to get your wisdom teeth out. The reason is that the experience of a younger patient is so much better than it is for an older patient that we're more apt to consider a preventive procedure, whereas in adults we want to have a pretty good reason to go forward with the removal of any kind of tooth, let alone an impacted tooth.
Now, what happens during surgery?
Well, most patients are sedated and they're pretty comfortable while we're taking care of them. They come and see us for a consult, at which time we look at their medical history, look at their dental history, review the imaging that we have that tells us what the situation with the wisdom teeth is, and talk to our patients to find out what their situation is. You know, are there things that make them anxious? Are there things we can do to make them feel better? So when they come in, a plan has been already in place that we begin to work on to get them to a point where they can most readily and easily go through the procedure. The procedure takes usually about 40 minutes to an hour, and our patients are usually with us about an hour to an hour and a half before they go home to rest. All of these things are discussed in great detail with each patient and their parents, or each patient and whoever is with them, so that there's plenty of time for them to make plans and, again, to get through this in the most predictable and comfortable way.
So what happens after surgery?
Well, like any surgery, there's going to be some swelling and discomfort, and this can be something that's pretty mild or something that's a little more involved. And of course, there are issues like infections and so forth that can prolong a person's post-operative course. We work really hard to avoid those things and head them off at the earliest possible minute. Most folks find that the maximum swelling and discomfort they have is on the third day, which is true of any injury or surgery. And then they begin to get better pretty rapidly. You know, once they turn the corner, they start feeling pretty well, and their diet starts to return, and they're loving life again. We follow them along, usually by telephone, but pretty carefully to make sure that everything that could be done for them is being done and that they're in the best possible situation.